Do you know that kidney disease is very common these days? Like kidney disease those days used to be like something that is very rare in the hospital. Before you tend to see somebody having a kidney disease, it was very rare. But these days, kidney disease have become very common that every single day, ladies and gentlemen, we tend to have a patient who has a kidney problem. And this is becoming alarming. And then we need to talk about it because kidney is one of the most important thing in our body. What does our kidney do? Our kidney is what regulates our body fluids. So the blood that is in your body, when you eat, when you drink, there are certain contents of those drinks that the body doesn't need to use. So the body is supposed to excrete them. And one of our major organs that tend to regulate those substances is the kidney, especially our electrolyte levels. When we talk about electrolyte, we are talking about our sodium levels, potassium levels, calcium levels, phosphorus levels. All those electrolytes is our kidney that tends to regulate how they work, their quantity in our body. Okay. Our kidney also has another function that it tends to produce a certain hormone that we call erythropoietin, and erythropoietin tends to stimulate the bones to produce RBCs. So if your kidney is not working, or if your kidney fails to work, you are going to have problem with anemia. There are a lot of things that come with anemia. Okay, very complicated state. Now, how come kidney disease in those days is not common like how it is in these days? Ladies and gentlemen, it's based on the life that we are living these days has gotten to the point that it's you go to work, you sit down, you do your work, you go home, you go to work, you sit down, you do your work, you go home. That is the routine that a lot of people are facing. And then this is becoming a problem. The up and downs in the name of we are looking for money is what is building what we call stress in our daily lives. And let me tell you, ladies and gentlemen, stress is the pioneer of a condition we call hypertension. Now, a lot of kidney disease patients have what we call hypertension, and then hypertension is a very dangerous disease. Very, very dangerous. Why is it very dangerous? Hypertension is dangerous because it will never tell you that I am here. It will never tell you that it is there until it tends to destroy a certain organ that is in you. Are you getting it? So now, look at it like this. Hypertension is like a silent killer. So it will be there. You will never know that you have high blood pressure. Hypertension is the same as high blood pressure. You will never know you have hypertension or you have high blood pressure until it tends to destroy a certain organ in you. And one of the organs that tends to be affected by hypertension is your kidney. The main reason why I'm talking about or I'm making this video is regular monitoring of our blood pressure is very, very, very important. Like a lot of people tend to see it as when you go and measure your blood pressure, it means you are sick. I don't know the kind of idea that is it, but see, it is the opposite way rather. When you measure your blood pressure, then you know what is wrong with you. You know whether your blood pressure is in the normal range or is outside the normal range. Ladies and gentlemen, it's as simple as that. If you tend to know your blood pressure, or if you tend to know your numbers, you will know whether you are safe or you are not safe. If you are not safe, they'll put in measures to help you. If you are safe, good life, continue doing whatever that you are doing that is keeping you safe. Very simple as that. The main purpose of this video is to tell you that, see, put your blood pressure under monitoring. See, it won't take anything away from you. Most pharmacies have blood pressure measuring monitors. When you get to the hospital, they have blood pressure measuring monitors. You can't tell me that you go to the hospital and tell them you want to check your blood pressure and they won't check for you. You are lying. And now blood pressure monitors have become very, very common to the extent that there are about 200. There are some of them that are sold for 200 CD, 150 CD, 300 CD. You tend to get some to buy. Buy one, put it in your house. When you wake up in the morning, monitor your blood pressure. It is very, very important. When you measure your blood pressure is supposed to read 120 out of 80 coming down. So 120 over 80 coming down. When you tend to start seeing numbers that are elevated 120, 80, there is a small problem. From 120 to 129 over 80 to 89, you are maybe, it's okay, it's not all that bad. But when you start to enter into the 140 and above, then your diastolic is about 90, the down one is about 90 and above, then you are hypertensive. When you monitor, like when you check your blood pressure consistently for some time and then it tends to reach that number, then yes, you are hypertensive. And it's very, very important. See, you need to get to the hospital and put yourself under monitoring, because when you don't get to the hospital and put yourself on drugs, what is going to happen is that hypertension tends to cause kidney problems. As I said earlier on, that there are lots of kidney problems that are coming due to hypertension. You are going to get stroke. Hypertension tends to affect the brain, and there are lots of more complications that comes with hypertension. You can get blurry vision, you can get liver problems, you can get heart failure, heart attack. A lot of things come with hypertension. That is why it is called a silent killer. So ladies and gentlemen, know your numbers. Just know your numbers like the way you know your telephone numbers. It's very, very important, and it's going to take you far. Okay, my name is Kelvin. If you want to keep getting more health tips of this sort, don't forget to subscribe to our channel, because our aim is to create a healthy community or a healthy environment where everybody will feel safe. I'll see you in the next one. Peace.